2, 3. 1, 2, 3. 1, 2, 3. So now on that we're adjusting the first 8 rib heads. That's the boy. And we let him talk. We don't really care what he's saying, but he's got to express his opinion. Now, let's go back. We'll just tie back up so everything's the same, and we'll retest. There we go. Now you need to know too that the spines of the vertebrae actually back here are facing forward, and they actually go this way. Right about here, they're facing together, and they go like this. And when they go up here, they start going back this way. So the angle is different in the front of the back than in the back part. But there's still motion that we're looking for. See, we've got more motion now. He's not really happy about it, but at least we have motion. There we go. There we go. There we go. And there again, it's painful to him to some extent. He wants to smell and see if I'm angry. Okay. Now, there's a muscle that comes out of the armpit and goes way up here to all these vertebral bones and the ribs. And I can adjust it by using the front leg. There's also a muscle that goes from the bottom of the shoulder blade to the radius, which flexes the elbow. And when I adjust this muscle, I'll also be adjusting this muscle. And there's also a muscle that goes from the back side of the shoulder blade all the way up to the neck. And it's very flat, and it's one of the major suspensory apparatus muscles in the body. It also goes back here. We'll be adjusting the front of this. Whenever you do an adjustment, you're using joints to stimulate the nerves. So we're going to be using 2 joints. One is the shoulder joint, to stimulate the nerves that affect these muscles. And we'll also be adjusting using what we call the scapulothoracic joint, which is not bone on bone. There's the scapula on the thorax, and it is a joint. It's bone moving over bone. There just happens to be muscle in between it. So to do that, I'll take this front leg, and we'll just ease it up here until he's uncomfortable. And then when he's uncomfortable, that's pretty good actually. Now see that? See the discomfort there? That was the latissimus dorsi muscle. That's the one that goes to the back. When I came up higher, that was more this and that. And you saw I could go up pretty high. I'm not even tall enough to go high enough to make him uncomfortable that way. But when I pulled it forward, I was really stretching this. And you saw how painful it was. That totally correlates with the amount of difficulty I'm having freeing up these thoracic vertebrae. So now we'll do the other side, because there's 2 sides. And we can evaluate his discomfort response with the severity of the problems a lot of times. And so now here we go. I'm going to take this one forward, up high, a little more discomfort than the other leg going up high. But let's see what we do when we come out forward. Not near as bad. There we go. Now the adjustment occurs the instant all of his weight's on the body, and I'm holding that leg. So to get a neurological response from a chiropractic or osteopathic adjustment, you have to stabilize a joint and then motion it in a certain way. And that will stimulate mechanoreceptor nerves in the manner that we want. So when gravity will stabilize that, I'll stabilize the joint, gravity will motion it with his body weight. And I'm breathing heavily because he weighs more than I do. Okay, so now let's retest. Every time we do these, we go back and retest. But my evaluation, and I don't know how much I'm going to know, but I thought he was a lot sorer on this side than that. And that correlates with what we found earlier on the rib cage, with the with those ribs in the back. Now, there you go, Pooch. So let's just retest this. That's pretty good there, but you know, now we're getting more motion, maybe just a little more discomfort when we get that extra amount of motion. That's good. That's better motion. Better motion. Not great, better, and a lot less pain. It's not perfect motion, and we're still not getting a whole lot up here. So I would suspect in this area here, he's got some long-term fibrosis. Now we can get more motion there mechanically, but we'd be ripping stuff. So we're not going to do that. We have to live with what we got right here. So at this point, I think we're in fairly good shape right here today. I think there's still some residual painting back here. Not too bad right in here. When he gets up in here, as he gets closer and closer to the neck, he's stiffer, stiffer, stiffer. And that probably is coming from the posturally induced pain here, and then your tightening of these muscles. When this is sore, the brain and nervous system will cause this longissimus muscle to stabilize this joint and decrease motion. It's huge. It's the longissimus dorsi. These muscles have to fight against that. They'll try to move it, they won't, and they'll end up just tweaking these rib heads. Each rib head is a joint, and each joint has joint tissue around it of all different kinds, tendons, ligaments, joint capsules, and they're very tiny. These muscles are huge, so they're really whacking on those things. And there could be other problems too. There's lots of things that can hurt him up here, but we may not know exactly why, but we definitely know that he's still resistant there. Now I'm going to work on the neck itself. And the thing you have to realize is, he's a little stiff on this side of the neck. Now it's not just a neck joint problem. There's muscles causing that. There's nerves telling the muscles to cause it. There's damage during his life that influences the nervous system that causes those muscles to tense up. And there's probably trauma involved and all kinds of things. And see, he really doesn't want to turn his head that way. And that's okay. We'll just push him over here. And there we go. We're going to just relax, take a little time. Tense patient really can't be adjusted. As soon as I get to where I want to be, he just moves his head, and that's okay. We'll do this 5 or 6 times, and I'm going to catch him off guard and adjust him. So far, I haven't been able to catch him off guard. There you go. That's fine. Sometimes I'll rub their ears, just relaxes them. Here's one. We're adjusting joints down here. As we get up here, the angle is slightly different. The angles are pretty much the same from about here to here, pretty much. Down here, they start changing. So you'll notice, if you look really closely, that I may pull his head a different way for different joints. We like a horse to be able to stick his nose in the armpit, and we like him to be very round. He's still pretty flat in here, so I've got a couple up higher to do, at least one. We'll do that. There's more than one way to adjust the neck. He seems amenable to this. There's more than one way to adjust any joint in the body. We just do the one the horse says that's the easiest and is the most effective for that individual. So I never adjust 2 horses the same way because there's no 2 horses that are identical. But we do use techniques that are, the techniques are always the same. We just don't use the same technique in every horse. There we go. You see there's still, he really resents me forcing him into that. So it's either a memory of pain or a real pain, or he's just a jerk. I don't think he's a jerk, but there are horses out there that are. Okay. See, so there we go. We got another adjustment right here. I can probably get because I haven't adjusted it yet. Gotcha. There we go. We like him to lick and chew and shake. It does not mean the adjustment was any good. It just means everything's okay. And maybe there is something going on, feeling good. if they pin their ears back and chase me out of the stall with their teeth, that probably was bad investment. Don't do that on camera. But we do like to see them happy afterwards, because we know it's a painful area we're going into. There we go. You know, we've got some improvement here. It's not perfect, but this is fibrotic lesions. There are fibrotic lesions in here too. I can feel that. You know, you have to be trained to feel the resistance and evaluate what you're really feeling. If I keep going on this side of the neck, again, I can rip some stuff and make it more maneuverable for the next few minutes, but then the next month or two, he won't be able to move very well, so that would be counterproductive. And look at this side already. That's a lot better. He's got a little bit going on right here, which we'll fix. But this side, there's not the tension. There's a little more motion already. Gotcha. And I don't know if you heard, we had an audible on this side. We didn't on that side.
Mm-hmm.
An audible is just a gas bubble that builds up with disuse of part of the joint. So if the joint's supposed to do this, and it's only doing this for a while, there's a muscle holding it. There's a nerve telling the muscle to hold it. A gas bubble will build up on this side. When it releases after adjustment, it can go and pop that gas bubble. But if it's been tight for a long time, this muscle will actually shorten. And there's no physiological way it'll pop that, because now it can't go back up. It's freed up, it just frees up. Now over the next 30 to 60 days, that muscle can lengthen with use, as long as it's not hurt again. So when you don't get audibles, which we haven't been getting a lot on him, when you don't get them, that's a sign of chronicity. When you do get them, that's a sign of acuteness. You'd always rather have an acute problem most of the time than a chronic one. Now, you know, an acute bullet in the head is probably worse than a chronic back pain, but for the most part, you know, acute problems, you know, they've been there a little shorter period of time, so usually, unless they're terribly traumatic, they're easier to fix. But, when we just look at this again, that's a boy, that's a boy, that's a boy. And see, he's not perfect on this side of the neck either, but he's better. And I've got one more I can do here. But a horse, I see enough horses that can stick their nose comfortably in their armpit. I always think, well, why can't they all do that? You know, so they should be able to do that. Would be my opinion. That's a boy. And you notice his demeanor on this side. He's not near as nervous. There we go, another audible. That was kind of a loud one even. And I'm sure those adjustments feel good too, but that's not it's probably not the worst problem. He has worse problems on the other side. So there we go. That's a boy. We go a little slow on these after I adjust them, because he probably thinks I'm trying to adjust them again. I'm not. I just want to test. There you go. Can you stick that? You know, he could be better, but that's a lot better than the other side. And I don't think he can be better today. So now we're just going to check as soon as he gets done talking. This is really important, let him talk. A lot of owners will, as soon as I get done, they'll kissy on him and rub him and all that stuff. You know, it makes the owner feel good. I think it really hacks the horse off. I think they get upset about it. They want to express their opinion. And I've seen a lot of people getting bit, you know, because about the third time the horse says, get the heck out of here, I want to talk. So we want to always be cognizant of that. And I have to be that way when I'm doing this, because I need to relax. But you know, even when you're training a horse, of course, has something to say. If it's in a training cycle, it's probably better to listen. If you're in the middle of a show ring, then maybe he better suck it up. You're probably not going to do well anyway, if he's, you know, in that situation. Now, we look at several things in the pole, because this is there's actually a couple of joints here, and they're very complex. But it's moderately simple. We want to see if they can extend it. We want to see if they can flex it. He's got a little flexion problem there. And we want to see if they can laterally flex it. And we're dealing with two joints here, and also a joint back here. And they're so connected that you really can't, like, I'm going to adjust just this side right over here, but believe me, it's going to be affected by the joint behind it too. So we'll just, yeah, that's a boy. Gotcha. And there's multiple ways to adjust that joint. There's one where you can put your hand here and their head there. I just don't like doing that, because you don't have as much control. And sometimes I have a colleague who cracked his head open